The Knowledgeable Provider podcast is educational, entertaining, and not the same as medical training. The information presented here should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, go see your own knowledgeable medical provider. Opinions expressed on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. It's all fun and games until someone gets sued, am I right? Okay, on with the show. Greetings. Welcome back to Knowledgeable Provider. I'm your host, Jody Marks. Before we get started, just some housekeeping things, some changes that are coming to the podcast for this coming year, 2025. Perhaps you noticed the new intro music. Decided to refresh the intro and outro a little bit, so hopefully that'll be enjoyable. I'm not really planning on doing anything different as far as the podcast itself. The number of listeners seems to be fairly stable, and I've decided I can't really justify putting a ton of effort or money into advertising, pushing it, that sort of thing. So I'm trying to look at it more now as just a hobby instead of a thing that might really take off and be popular and all that. It seems like we do have a stable base of listeners, and I greatly appreciate you. It's very cool to see that people actually do listen to these episodes, and I hope that means that you enjoy it and that you want to continue hearing episodes from me. And the truth is, I enjoy it. Medicine's very interesting. There are a million different topics you can talk about and something going on every day that is interesting. So I think it's a very cool thing, and it helps keep my level of interest in my day-to-day work up as far as just looking for new things to talk about or things to learn about, things to share that might be interesting to the listeners. If you interact with the website at all, if you use the website to listen to the podcast, that's going to go away pretty soon. I think within the first few days of January. It was coming up on time to renew that service, and like I said, I just can't justify putting a lot of money into this. So if you listen on the website, you're going to need to find another way to listen to the podcast. If you want to use web-based still, I'd recommend the YouTube channel. I've actually made a separate YouTube channel just for the podcast instead of having it be part of my personal YouTube channel. So you can find that just by looking for Knowledgeable Provider Podcast on YouTube. Otherwise, any of your major podcast platforms are going to have this, including Spotify and Apple Podcasts and a whole bunch of other ones. Email address is still the same if you want to get in touch with me about anything. I don't generally hear from people, so I'm taking that to mean that no news is good news. But really, if you ever have any interest in talking about something in particular, if you want to be a guest on the podcast, if there's something you'd like to hear, if you have feedback for me, please don't hesitate to reach out and get in touch. This week's episode is something different that I've not done before. I got an email from an author, or I assume a publicity organization or a publisher, or I don't know. Somehow I was contacted about potentially doing a book review. So I went in and filled out a request form, and sure enough, the publisher sent me a copy of the book to review. So I'm going to take a shot at that. The book is Emergency Capnography by Hugh Greenbaum. One thing that caught my attention immediately is that the author is a paramedic. He's actually a volunteer with the Forest View Volunteer Rescue Squad up in Virginia. Of course, I have a special place in my heart for EMS and especially volunteer EMS. Talked a lot on here about getting my start in that kind of situation. Mr. Greenbaum is a retired systems and software engineer. It sounds like is making a second career or at least a retirement occupation out of EMS and EMS education, which is very, very cool. I love seeing someone who is not like a super duper world-renowned expert, MD, PhD, chief of capnography at Brigham and Women's Hospital or whatever, putting themselves out there and sharing knowledge and realizing that you don't necessarily have to have all those titles and credentials in order to be an expert or to be knowledgeable about some particular subject. And I guess that's actually a big theme of this podcast. I'm certainly not a world-renowned expert in anything. And most of the people that I've interviewed have not been super duper experts and people with advanced degrees and whatnot. So that falls nicely into the general milieu of this podcast. This book is intended to be a sort of pocket reference guide about capnography. Here's the way the author introduces it. Quote, "This portable and practical pocket guide explains how capnography works, both physiologically and electronically, and helps clinical staff to apply the tool promptly and correctly, and to interpret appropriately the numeric and graphic displays, providing vital information when viewed in the context of the patient's clinical presentation history and other diagnostic data that will improve and enhance care." Yes, that is one sentence. It's available in Kindle, paperback, and hardcover versions. The Kindle and paperback versions will run you about $20 to $30. The hardcover version will set you back $130. Those prices are from Amazon. The copy the publisher sent me is the paperback version. I wouldn't say it's exactly pocket-sized, but it is a small paperback. I am actually old enough to remember carrying around a paper EMS field guide in my pocket as a reference when I was working as a paramedic in the days before smartphones. It was like this little notepad kind of deal with spiral binding on top of it that was very densely packed with a lot of reference material and information. It actually did come in handy from time to time. I wouldn't say that this is a book that you want to carry around in your pocket, but it would be nice to keep at a station or in an office or even in a bag if you're out working on the truck. And this is geared toward pre-hospital professionals, EMS people, paramedics, but could certainly be useful to other folks dealing with capnography in different settings. What really kind of struck me about this book is how wide-ranging it is. In fact, I would even suggest that the title is a bit misleading because it does talk about capnography, and it talks about how capnography is integrated into all these different disease processes and how you might use capnography in a bunch of different ways when you're assessing patients. But the scope of what's reviewed here is actually way wider than that. I think you could get away with calling this a very brief review of a lot of different critical care topics. It is very dense. It's a short book. It's only like 110 pages, including all the table of contents, glossary, index, etc., all of which are very well done, I might add. And it's separated into short chapters with little paragraphs about each topic. But those paragraphs are dense. There's a lot in there. The author's taken information that would probably fill 2 or 3 different textbooks and just very much condensed it down into a very quick overview of these things. I don't think this would be super useful for students. I think in order to get something out of this, you're going to have to pretty well already understand what you're reading about. I would say this is just a nice review or overview. Maybe if you were studying for some kind of critical care certification or renewing a certification like that, or if you are transitioning into a role where you're going to have to deal with this more than you have in the past, maybe if you're going from ground EMS to air, or if you're moving into a facility or a unit that deals more with capnography. I really like how it starts out with a very broad overview of like, this is what ventilation and perfusion and metabolism are, and this is what acid-base balance is. And then it kind of goes into more specific examples of disease processes and how capnography might be utilized in those disease processes. It feels very well researched. There are a lot of sources cited. Initially, there are a lot of pictures of the devices and things that he's discussing, but pretty quickly the pictures and illustrations kind of go away. And that's another reason I don't think it would be super great for students, because your typical textbook is going to really break complicated things down into little simple bits and have cartoons and illustrations that kind of help drive home the points. But you're not going to get that in here for the most part. There are some flow diagrams toward the end of the book that kind of offer a little visual guide on how to think about the information that you're getting from capnography and what direction that information might lead you in, but otherwise not a ton of illustrations. This is not a self-published book. It's published by CRC Press, and it's well done. It feels like a legit book. Run-on sentences notwithstanding, overall it's well written. I wasn't distracted by problems with grammar or things like that you sometimes get in things that are self-published. I don't really have any criticisms of this book. I pretty well read it cover to cover. It took me maybe an hour and a half, so it's not like a textbook or a study course that's going to take you hours and hours and hours to get through. It took me a little while to figure out kind of what the vibe was. Initially I thought, oh, this is a really nice, simple overview that students might find helpful, but it very quickly gets into very specific kind of nerdy details about capnography and the machines and whatnot that are used. And then once it goes into the disease processes, physiology and whatnot, it would be way over a student's head if you didn't already know what you were reading about. My only other criticism, I guess, would be the price of the hardcover. I would suggest not ordering the hardcover. You really don't want to pay $130 for this, but I think the price of the paperback is pretty reasonable. I don't use capnography in my current practice. I'd say maybe within the last 5, 6, 7, 8, I don't know. The last few years of my EMS career, it was becoming more of a thing as far as mostly using it to confirm and monitor ET2 placement. I had never really learned much about how to use it diagnostically. I guess maybe the one thing I could have told you is that the shark fin appearance of the waveform indicates bronchospasm, but it was not really anything I ever integrated into my day-to-day practice as a medic, really. And maybe that's different now. I hope so, because it is a very useful tool. Of course, working in the PEDS ICU, I had more interaction with it as far as monitoring intubated patients. At that time, we didn't really super use it a lot in kids who were not intubated, but I can see, especially with so many respiratory problems in the pediatric population, how it could be very useful. And maybe that's something that's being done more now. I don't know. I did learn a couple of things. One little tidbit that I picked up that I thought was super interesting was that capnography can actually be used as a form of biofeedback for patients who are having severe pain, who can't get pain medicine or are not going to get pain medicine for whatever reason. You can actually kind of put them to work monitoring their end-tidal CO2 level and adjusting their respirations to keep the numbers in the normal range. That would serve as both biofeedback and a useful distraction. I thought that was a really cool idea. I don't think it ever expressly said this in the book, but it's not much of a leap to think you could potentially do that with somebody who's hyperventilating also as a way to kind of help them calm down, give them something to focus on. Another suggestion I liked was that capnography might be more useful than doing orthostatic vital signs when you're assessing somebody who had a syncopal episode or near syncope. And that might make more sense to use to give you an idea of whether this is a metabolic or respiratory problem, whether you really need to worry about hypovolemia or orthostasis or not. One thing that this book is really not is a quick reference of like specifically capnography things. If you're just looking for a list of different waveforms and what those mean, you can find those pretty easily just from a Google search. There are several different places where you can get that information for free. And there definitely are some different illustrations of waveforms and what those mean in this book, but they're not really condensed into a quick reference kind of area. It's set up more like, here's a chapter on respiratory illnesses, and here's the waveforms that you might see with that, and here's the chapter on cardiac problems and shock, etc. So it's kind of laid out that way. I would definitely call this more of a review book than a quick reference kind of thing. And yeah, that's pretty much what I have to say about it. Overall, I enjoyed it. I would say that it exceeded my expectations, not really knowing anything about the author or what type of book this would be beforehand. Thank you to the author, Hugh Greenbaum, publisher CRC Press, for the opportunity to review it and for the free copy. If you pick up your own copy and have thoughts to share about it, get in touch. I'd love to hear what you have to say. Hope everyone's having a safe and enjoyable holiday season. Thanks again for listening, and I'll talk to you later.
All right, that does it for this episode of Knowledgeable Provider. Very special thank you to our Patreon supporters. If you would like to help support the show for just $5 a month, please head over to patreon.com/knowledgeableprovider. If you're looking for more content, check out our YouTube channel and our Facebook page. Remember, all of those ratings, reviews, likes, follows, subscriptions, etc. really do help the show, so take a second and do those things to help me out. If you have a request for an episode topic, or if you'd like to be a guest on the show, I'd love to hear from you. Email me anytime at thekppod@gmail.com. That's thekppod@gmail.com. Thanks so much for listening, and as always, stay safe, take care of yourself, and take care of your patients, in that order.